Well, there really are two different types of common hip approaches used in this area anyway. There's more than that, but in this area there's anterior hip replacement and posterior hip replacement. Posterior hip replacement is more traditional, what people have done in the United States. Anterior hip replacement, although it's been around a long time, has been popularized in the past decade and a half, and has become very, again, popular to do because of some of the things that it allows patients to do right away. Anterior hip replacement doesn't go through the back of the hip, and what that does for people is it makes their risk of dislocation a lot less, which is good, okay? The other thing that I personally like about anterior hip replacement is the patient is lying flat on their back during surgery, so we can pull in a live x-ray machine and check all the angles and lengths and things like that, which is much harder to do when a person's lying on their side. And so there have been some studies that show that accuracy of placement of components is a little better through an anterior approach. However, anterior and posterior approaches have very similar results. You can't tell the difference between them after about 6 weeks. Anterior hip replacements probably get better a little quicker. That's been shown. In other words, you can walk a little sooner without a supportive device. Patients report from both hip replacements that they do well pretty quickly, but probably a little quicker with an anterior hip. They are what we call hip precautions. In other words, what position you don't put your leg in are different because you come in from a different side of the hip. Different surgeons are different about how much they limit patients from what they do post-operatively, but let's just say that they're different. Anterior hip replacement is discussed a lot because you can go between muscles to make it happen, and I think that does have some beneficial effect in early pain in anterior hips. You're going between some muscles, as opposed to posterior hip. You have to split the gluteus muscle, the buttock muscle. But what you have to remember is it's not so much the approach as it is the surgeon you're working with. For instance, I had my hip replaced in 2019, and I had mine done posteriorly because the surgeon I wanted to do the surgery did his posteriorly, and he was the guy I trusted. And that's what really matters most, because you can get the same result.